Cold winter months are especially difficult for those who suffer from skin diseases because the cold and dry weather can irritate the skin and cause flare-ups. More than 6.5 million Americans live with a disease called plaque psoriasis. The condition affects the skin, causing plaques, itchiness, and flaking. There are misconceptions around the disease and often mixed up with other conditions like eczema. Today we meet with Dr. James Song, who specializes in inflammatory skin diseases, and with Margie, who is living with plaque psoriasis and will talk to us more about her condition. Dr. James Song, thank you so much for joining us here today, and Margie as well.
Thank you for having us.
So tell us a little bit about Dr. James Song. Tell us a little bit about, there's a lot of misinformation out there about plaque psoriasis and what it is. So what is it and what are some of the symptoms of it so people can look out for?
So plaque psoriasis is an autoimmune disorder of the skin. It leads to chronic inflammation, and it could affect areas like the scalp, the elbows, the knees, but even the skin folds and nails. And symptoms can range anywhere from itching to burning and even soreness, especially when the skin starts to crack and bleed, like we see on the hands and feet. And psoriasis can affect all age groups, typically 20 to 30 and 50 to 60 are the peak ages, but it can affect everyone. And it also affects all skin tones. So if you're more lightly complected, it could be more pinkish red, whereas if you're more darkly complected, it could look more purplish gray. And then finally, psoriasis, as you mentioned, it could flare in the wintertime because the weather gets colder and drier, and the lack of sun. These are all things known to trigger psoriasis.
And so it's very kind of sometimes difficult between, to spot it in a way, would you say, just because what if some people think it's eczema and they mix it up for eczema, but really it's plaque psoriasis? Like, how can you really, what is maybe a main hint what to look out for to see that difference of it?
Yeah, that's a great question, and sometimes it's not that straightforward. What I can say, though, is that classically, eczema and psoriasis, they have a different color. The scale quality is also different, and they tend to affect different areas. So psoriasis, like the elbows, knees, and the scalp, whereas with eczema, it tends to be more on the cheek, sometimes on the elbow creases and behind the knees. Also, patients with eczema, they tend to have other medical conditions like asthma, food allergies, hay fever. So sometimes that could clue us in on a diagnosis as well.
Margie, you have lived with plaque psoriasis, is kind of in the cold winter living conditions. So tell us a little bit about when did you first notice you had this condition and how did you know what it really was?
Well, my experience with plaque psoriasis has been for the last 4 years. And mine is primarily on the palms of my hands, and it will go up onto the tops of my hands as well. The minute I saw it was not really the first time I experienced it, because the itching and the burning of my hands was there. And then all of a sudden I saw a dry patch in the middle of my palm, and I thought, this is really strange. So I went right away to a dermatologist and was diagnosed almost immediately with psoriasis, and then started my journey on how to help me and how to combat or make it a livable disease. But up to that point, it was difficult because, I couldn't cook, I couldn't bake, I couldn't garden.
When you got that diagnosis, what did the doctor say? What that could help you better with your daily habit of life and could kind of help you also feel at ease mentally, when you do meet new people?
Yeah. He immediately put me on we started this regimen of the medications that I could use. And until you hit the medication that really works for your particular psoriasis, you're at an impasse. You have to just keep trying as much as you can with creams and things like that to moisturize. You keep your hands moisturized and take care of the itching, which is usually a prescription from the doctor.
Well, thank you, Margie, for that. And Dr. James Song, have a website that you recommend personally or a source where people can go to learn more information based on what your recommendations are?
Absolutely. So www.somethingdifferent, so it's all one word.com, has additional information on what psoriasis is, as well as other treatment options that are available to everyone.
Okay, well, thank you so much for your time, Dr. James Song, and Margie for joining us and telling everyone about the condition and how to stay aware during the cold winter months especially. Thank you so much for your time, and thank you for joining us here today.
Thank you for having us.
And we will be right back after this break.